FM. The time is now 6 o'clock.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Martin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that all of us had a nice and positive week so far and looking forward for a nice and relaxing weekend. This program is broadcasting live from the platform of Inspire FM today on 26th of November 2020 and casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpen, Bedford, and our positive airways reaching to all our lovely listeners who are listening us through Inspire FM app, website, or you can view us via Facebook live app or by YouTube live channel as well, both of them through the Inspire FM Facebook page and Inspire FM YouTube link. So as we know, we have covered different health related topics all the time, and today's topic is very unique in a sense that we have done a 4-part series for this particular program, and this program is basically the flu vaccination section. And yes, indeed, flu vaccination is something which we have covered intensively throughout this last 2-3 months, we have highlighted the importance of flu vaccination. And whenever I do something like that, I always start my program with a quotation saying, "Prevention is better than cure." Yes. So without further ado, let's talk about our topic for today. And the topic of today is flu vaccination for all. Yes, you have heard me correctly. We are talking about flu vaccination for all. And no, I'm not the only one who will be talking about all by myself. I'm joined by two lovely guests with me in the studio, or virtual studio, that is, on this show. And they are, and let me introduce our guest for tonight. So joining me today is Dr. Sunita Chakravarti and Barbara Hamill. Dr. Sunita Chakravarti from CCG and Barbara Hamill from Public Health England / NHS England. Good evening to both of you.
Good evening, Fahad. I'm delighted to be here to talk to our guests about the flu vaccine and the importance of it.
Thank you so much. Barbara, I can't hear you. Hello, Barbara?
Can you hear me now?
Yes, I can hear you. Perfect.
Hello? Yeah?
Yes.
Good.
So if you don't mind giving a quick introduction about yourself, both you and Barbara, Sunita. So let's start with you, Barbara, because give a quick introduction about yourself.
Okay. Hello, everybody out there. My name is Barbara Hamill, and I'm the Immunisation Manager for Hertfordshire, Bedfordshire, Luton and Milton Keynes. And I'm very pleased to be here today because I want to help you protect your health and be well and be happy and everything else.
Indeed. And Sunita.
Good evening, viewers. Assalamu alaikum. I'm Dr. Sunita Chakrabarti. I'm a public health doctor, and my clinical practice is in women's health. I work for Bedfordshire, Milton Keynes and Luton, and I'm here to talk to you about the importance of the flu vaccine and support you to have a better winter this year. We've not had the best of years, but we can have a better winter if we protect ourselves with the flu vaccine.
Indeed, and definitely, these are the very tough times we have ever seen in our last 100 years. I can say, yes, I can say that, because pretty much it was beginning of the century when we had a bit kind of, or shall I say, almost 100 years ago, when we have things like First World War, we have pandemics and problems and issues across the patch. So Alhamdulillah, we have been technologically advanced in many different ways, and we have moved further. Now, today's topic is about flu vaccination, and as I said, that we have done a 4-part series of flu vaccination, which we have covered about flu pretty much intensively, about majority of the things. And today is like a catch-up session where we will be talking more about it. So I will not start what is flu. I will start why flu vaccination is. Why do we vaccinate against flu? So is flu that bad?
Definitely. And this is one of those. It's a virus. It's highly contagious, and particularly if you have an underlying condition, it can be really quite dangerous and give complications. And also, the flu vaccination is the only way of protecting an individual against getting the flu. And the unfortunate thing is as well, some people can be what we call asymptomatic, don't have any symptoms at all, but can go within the community and spread the flu. So it is very important for all those who can be vaccinated, be vaccinated, because the particular series, like I said, for people with complications, older people, very young, and again, people with, I'm going to reinforce, people with underlying medical conditions, those at risk. And also, not to forget, it can also kill otherwise healthy adults and children too. So it's not just, it can also have an impact on healthy people.
Indeed. And on that note, you just literally remind me that it's a good idea to involve our listeners as well. So listeners, if you have any questions or queries regarding our topic tonight, which is flu vaccination for all, please get in touch with us by sending your questions by text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. Or you can send your questions via Facebook app or via YouTube channel if you're viewing us by Facebook or YouTube. So yeah, just pop your message through those venues and get in touch with us, ask us, or if you have any experience, positive or negative. We have two lovely experts regarding this subject matter with us on this show. Please get in touch with us. So if you want to send us a text message or WhatsApp, it's 0779 481822. I repeat, 0779 481822. Or if you want to send us a message via text message or via Facebook or YouTube, just send a message through them. So in terms of the when we talk about flu vaccination, we always talk about the groups of people who are entitled for a free NHS, because one of the common conception, especially for this year, is that anybody can go and get a flu vaccination. There's no limit for it, and apparently it was more people who are not eligible ending up asking for flu vaccination than the ones who are eligible. So can you please let's shed some light on this topic, as in which group of people are entitled for a free NHS flu vaccination? Sarita?
Okay, so so the people who are absolutely eligible, and as Barbara was alluding to, is the people who are more vulnerable to get the flu. And I was just going to add to what Barbara has already said, that although every winter many of us feel like we've got the cough and cold, and we say, oh, we've had a really bad flu. A bad flu can be really, really severe. And if the flu virus affects some of our really sort of vulnerable people with neurological conditions, who've got cancer or who've got severe lung conditions, they can end up really poorly and in hospital. And every year from December onwards, when the flu virus starts to circulate, we do see quite a fair few of our people who end up quite poorly in hospital. This also goes to, so just to talk about who are the eligible. So we've got our over 65s. So anybody and everybody who is over the age of 65, you should have had your invite by now from your GP, and you should have at least had a few phone calls from them if you've still not got your flu vaccination. It's very, very important, particularly for this year, because the flu virus is a virus which then gives you an infection, which reduces your immunity. This year, we are in a pandemic year. We've got COVID-19, which everybody's interested in, and it's circulating. Once you get a viral infection, if you get flu virus infection, then the chances are, you could also end up quite poorly with COVID. So if you're at risk of flu, basically you're at risk of COVID too. So I know people are interested and don't want to get the COVID. Getting the flu vaccine will help you to at least stop getting flu. So that is at least one thing that you're guaranteed of. So over 65s, that's the main group. Then we have got the people who've got long-term medical conditions. And these are people with long-term heart conditions, lung conditions, liver disease, neurological conditions, people who are on medication where their immunity is suppressed, people who also have diabetes. And I know fair few of our visitors may have diabetes. So they are all eligible for the flu vaccination. And so it doesn't have to be that you have to be over 65. If you're anywhere between 6 months to age 65, you are eligible for the flu vaccine. The other most vulnerable group are our pregnant mothers. So it is very safe to have the flu vaccine in pregnancy. It protects mums from getting very, very nasty viral infection in pregnancy. To have a healthy pregnancy, we need to be really strong. So the flu vaccine is safe to take in pregnancy. Not only is it safe and keeps the mum healthy, it also gives the baby protection for when the baby comes out. There is reduced numbers of respiratory conditions and stuff that babies suffer from when they're born. That can be also reduced if mum has the flu vaccination. So very, very important. The next group is the children. So many of our school children should have already been invited, and they are being vaccinated through the schools as nurses are going out to schools and vaccinating them. So that's another very, very important group. 2 to 3 year olds, so who are not in school, are going to be invited by our GP practices. And again, those letters have probably gone out to parents. Parents, if you still haven't got your 2 to 3 year olds vaccinated, please take your children in. And more importantly, you should be also getting some phone calls to remind you to take up the offer. The other big group is our carers. So if you're looking after somebody who's vulnerable, who's got a long-term condition, and you are their main carer, then you are eligible for the NHS flu vaccine. The other group that has been added this year is the 50 to 64 year olds. And that the healthy 50 to 64 year olds will be invited by their GPs. We've just got information about those vaccines coming round to our practices. So hopefully in the next few weeks, you should, if you're a healthy 50 to 64 year old and you want to get a flu jab, don't call your GP, because your GP will be calling you for that. Barbara, have I covered all the cohorts?
You've covered nearly all of them. Just learning disabilities.
Yes.
Really important.
And people who are, and the carers of the or household of the people who are on the shielded list.
Shielded list, yes.
Yeah.
I was just going to cover that. So also our people who got severe mental illness and learning disability, as Barbara said, are very important because they're very vulnerable. And again, we don't want them to end up in a hospital with a bad flu virus. And those people who've been identified as clinically extremely vulnerable. So we were called the shielded list before. Now we are on the clinically extremely vulnerable list. The household members of these patients are eligible for their flu vaccination. So if you've still not got your flu vaccination, then you can contact your GP and get your vaccine, because when you're taking your flu vaccine, you're basically protecting the vulnerable person who's clinically extremely vulnerable and on the shielded list. You're protecting them as well. Of course, they should have already had their invite and should have already got their flu jab.
Now, while you were talking about the kids and the flu vaccination, I just literally popped a question just popped on my screen, and it says, and I'm just literally reading it. It says, "Can flu vaccination injection in the injection form be given to a child under 4-year-old?"
Yes, they can. Yes,
So,
absolutely.
so can they get it from the GP surgery or something?
If they're under 4, they need to go to the GP surgery. Yes.
Okay.
If they're at risk, absolutely.
One of the So if they're not at risk, and but they've been invited, like as you said, the 2 and 3-year-old, can they get
the 2 and 3-year-olds can get at the GP as well, and it depends where their birthday falls for 4. They can either go to their GP or they can go to their. They will be picked up in school.
Right. Okay. Cool.
And any child at risk should have been called early anyway, because they can go to their GP. Even any school child, if they've got an at risk, they don't necessarily need to wait for the school session. They can go to their GP for the vaccination.
Because one of the beauty about this year's flu vaccination, and I'm calling it as a beauty because there are 2 cohorts which has now recently been added, as Sanita mentioned, that anybody who's 50-year-old and above, regardless whether they have any long-term condition or not, they can get free NHS flu vaccination program. And also the kids who are for 2 and 3-year-old, and it's also school-age children who are concerned about the vaccinations, the nasal vaccines, because nasal vaccine contain flu content, the pork content. They can have non-porcine vaccination, isn't it, Barbara?
Absolutely. We've now got the option, and it's really exciting news. So any parent out there who does not want their child to have the nasal vaccination, nasal spray, it is clinically better, but there is an option, and that is the non-porcine, the vaccine without the pork, and that's coming for the first time for all these cohorts for school children and 2 and 3-year-olds. So please, can I say out there, if that's been your problem, please go and get your child vaccinated, and you can have a vaccine that has no pork content whatsoever.
So in terms of people who want to get vaccinated, where can I get their vaccination? So let's talk about the people who are 50 plus and so forth. Where do they go? Can they go to places like pharmacies or somewhere else, or do they have to go to their GP surgeries?
No, they've got the option to go to either their GP surgery or to a pharmacist, whichever is more convenient for them.
And Fahad, can I maybe just come in on this very, very important issue, because we absolutely recognise the importance of sort of concerns that parents have had all these years around the nasal vaccine, and how difficult it has been for them. So now that this year our GPs have got the vaccine, it's almost kind of imperative that we kind of give this message to our parents who have been anxious that they were not able to take the nasal flu vaccine because of the pork content in it, and the gelatin content in it, and they were worried about it. So as Barbara said, if you've got your letter and you've kind of looked at it and thought, I'm not sure, I don't want to take my child in because the vaccine has got pork content in it, please can we urge you to take your child and talk to your GP and get the injectable, because that'll still give you the protection, still give your child the protection, which is very, very important, because as our social sort of distancing and some of our sort of lockdown measures are slightly going to be released a little bit over Christmas, surely after all this time we would want to see some of our family, if you've not seen your grandchild, or if you've not seen your nephew, niece who are little, and if they're vaccinated and they're protected, then the chances of them spreading the flu virus is going to be very, very much reduced. used. So I think it's really important for us to make sure that we take the option offer of the porcine-free injectable that is now available from your GP surgeries to take. So please, can we urge you to talk to your GP? And just on that, then, may I also add the other vaccines that we've got for the adults. They don't have any porcine content. So I know there is a lot of anxiety around that as well, because people think, okay, if the nasal vaccine has it, everything else has it. No, it doesn't. So the answer to that is no, it doesn't. And we would absolutely be truthful if there was. So again, if there is anxiety, concern about where your vaccine's coming from, what does it contain, please look up the websites and we'll put it on the web chats. But also talk to your GP if you're concerned. None of the others have any other content. Barbara, am I right? And then do you want to just sort of say that?
Absolutely. It was only the nasal spray that had the pork content. The others don't. So you can, anybody in any other age bracket, an adult can go absolutely to their GP and know that their vaccine does not contain it. It was only in the nasal spray, and now you've got the option. One good thing is that Luton, you were really a forerunner for this. We absolutely fought for you to have another option. And I know some of you have been involved in the Luton study. I know Fahad has, and Abdul Ghafoor has. We've had community leaders working with us for this. So we've really managed to get this change. And now this year, obviously there's a major change. So please out there, now that we've got an option to really protect your children, particularly if you're living in multi-generational families as well, it's even more important because children are spreaders. And we want to, give the protection to the family. So it's really important that, children are protected. And now you have got this option, and it's an easy option because there's plenty of this vaccine available. We've made sure that we've ordered plenty for the Luton population who would like this. So please come forward and get your children protected.
Indeed. And on that note, I must say, guys, if you have any questions or queries regarding the topic of flu vaccination, please get in touch with us by texting us your question on 07779 481822. So you can send text messages or WhatsApp on 07779 481822, or you can send messages via Facebook page, Facebook Live link, or YouTube link, which we are currently broadcasting from. So please get in touch with us. Let us know what you're thinking about. Why and have you get vaccinated yourself? Because I have, and I've been asked by my workplace and my GP surgery to get vaccinated, and it is good. By the way, I'm not 50 plus. But I do work in healthcare services, so I'm one of those people who are in that risk category. Anyhow, so moving on, in terms of the vaccine, and you have correctly highlighted the very important factor that most people do think. There are a couple of myths which are keep brewing up. And one of them you just tackle very nicely, Sunita, regarding the pork content, that people think that the injectable flu vaccination, the flu injections itself, may contain flu contents. And the second one nowadays is very brewing up within the communities, and they think that the flu vaccine might contain an unlicensed version of COVID vaccine. So what do are your takes on that?
So can I just assure anybody who's listening out there? So the flu vaccine is a very time-tested vaccine. Over the years, it's been tested. It's regulated very highly. There is no COVID-19 vaccine protein or any product related to COVID in the flu vaccine. It's a very regulated product. It's nationally mandated, monitored. Every year, there is a new, the vaccine is regulated and licensed, and we've got national groups who then authorize which strain of the vaccines can be then vaccinated with. So there is a huge rigorous process to make sure that the flu vaccine is absolutely, the right vaccine for every cohort. And as you know, for different cohorts of groups, so over 65s get a slightly different vaccine. The under 65s have got a slightly different vaccine. We talked about the porcine content and the nasal, which is for children. And all of those are very, very highly regulated. There is no way any of those have got any element of COVID-19 vaccine. What you're hearing recently in the news is about the unique COVID-19 vaccines that are being still trialed. We still don't know a lot about them. All we're hearing is the media messages and the initial findings, which is great news. And
Sunita,
that
I have to stop you over there.
Against the
I have to stop you over here, unfortunately,
virus.
because we are about to go on a very short commercial break. So when we come back from the break, can you hear me, Sunita? Sorry.
Yes, now I can.
So we are going for a short commercial break. So when we come back from the break, we will talk a bit more about this after these very short messages.
This program will continue after the break. Continue listening to Inspire FM.
Inspire 105.1.
My name is Naima Siddiqa. I'm a student at Luton Sixth Form College. Tune in Inspire FM 105.1 FM.
अगर आप बैरून मुल्क जाने का प्लान कर रहे हैं तो आपको जरूरत पड़ सकती है कोविड पीसीआर टेस्ट और सर्टिफिकेट की। अपना कोविड पीसीआर टेस्ट आज ही बुक करें with optimized body and mind, available 7 days a week for only £135. Other services include health MOTs, vitamin shots, IV hydration therapy, TRT and diet plans. Call 01582 323 007.
Biscott Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscott Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our Stop Smoking service. We're open 7 days a week till late, including bank holidays. Biscott Pharmacy, 157A Biscott Road, Luton. Call 457709.
Why do Tops Pizza deliver the top pizzas in Luton? For a start, all the toppings are 100% halal and Tops use fresh dough every day. Then there's the cheese, the highest quality available. And when it comes to food preparation, cleanliness is taken as part of our faith. So that just leaves the taste, choice and great offers, including buy one, get one free on all medium, large and extra large pizzas. Tops Pizzas, Wellington Street, LU1 5AA. Order online, topspizza.com or via Just Eat. Download our app or call 01582 72 5000.
Applications are now open for our September 21 reception class at King's House Independent School in Luton. It's where our dedicated and caring staff nurture young children in small classes, helping them to get the best start in life. And with our King's House School Early Learning Programme, we teach reading, writing and numeracy through a fun and enjoyable curriculum, whilst developing self-confidence and other talents too. If you'd like to apply for a place for your child, call Luton 491430 or click on kingshouseschool.co.uk.
As winter approaches, here's a critical reminder of coronavirus symptoms from Dr. Gupta.
The main symptoms of coronavirus are a high temperature or a new continuous cough or a sudden loss or change in your sense of smell or taste. If you have any of these, to protect yourself and others, it is critical you isolate at home, even if you don't feel too bad. And you must book a test immediately. Use the NHS COVID-19 app or go to gov.uk/coronavirus.
Stay alert, control the virus, save lives.
खून जमा देने वाली सर्दी, शदीद बर्फबारी और तूफानी बारिशों के बाद सैलाब की सूरत हाल। मुल्क शाम की सर्दियां जानलेवा हैं। शाम के जरूरतमंदों को खुराक, गर्म कपड़े और कंबल पहुंचाने में SKT की मदद कीजिए। आपके सिर्फ 20 पाउंड बेआसरा खानदानों के लिए बड़ा आसरा बन सकते हैं। कोरोना की मौलिक वबा और सर्द मौसम में अपने भाइयों को मुश्किलात से निकालने के लिए SKT वेलफेयर की मदद करें। विजिट करें sktvwelfare.org या 0300 302 0786 पर कॉल करें।
My mom I love my mum. My mum loves me. Loving and caring is her speciality. She prays to Allah for the Ummah's health, reading the Quran before I sleep. I love my mum. My mum loves me. So thank you, Allah. She does a lot for me.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host Fahad Martin for today's show, and we are talking about flu vaccination for all with our lovely guest today, Dr. Sunita Chakravarti and Barbara Hamill from Public Health. This program is broadcasting live today from the platform of Inspire FM on 26th of November 2020, and definitely casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpeth, and Bedford, and definitely reaching through our viewers from our online platforms of Inspire FM, either website, app, or Facebook, as well as YouTube channels. Good evening and welcome back. And I must say, wow, the time has passed very, very quickly for the first half, because it just literally passed through. I just realized when the red screen popped right in front of my eyes saying it's last 60 seconds remaining. So I must say that is really, really good. During the break, before we went on break, and I have rudely interrupted you, Sunita, you were talking so much nicely about the myths about the vaccinations, especially you were talking about the COVID vaccines, that people were saying that they might be unlicensed version of some kind of content in the flu vaccine, which you said that there isn't it? Sorry, if you carry on from there, if you don't mind.
Yeah, thank you, Fahad. Just to reiterate then, therefore, that the flu vaccine is completely separate to the COVID-19 vaccine, and it's not the same. The flu vaccine is for the flu virus and protects you against the strains of the flu virus that are circulating this year, and protect you against the flu virus, which is a completely different virus to the COVID-19 virus. And there is no reason or any any regulation or anything to say that the COVID-19 virus is any way within the flu virus. So if you've got any concerns, again, advise you to go to some of the NHS websites to get your information, or talk to your GP. All the information that you're getting around the COVID-19 virus, which we still are learning as we go, is very much for the new virus, which is the COVID-19, which has kept us all awake for the last several months now, and sadly is causing a lot of sickness all around the world. That is a completely different virus to the flu virus, and the vaccine therefore will be very specific to that virus, which is a coronavirus, which is different to the flu virus, influenza virus, which is a different virus. So just to reiterate again, the flu vaccine doesn't have anything to do with the COVID-19 vaccine at all. It doesn't have anything to do with the COVID-19 vaccine. The COVID-19 vaccine is a completely separate vaccine for a different virus completely. So if you're anyway concerned about not taking your flu vaccine because you're worried that this year it's got the COVID-19 vaccine, please get the advice and attend. But if you, as I said again before, if you're at risk of flu and you've been invited for your flu vaccine, then it's best to get it, because if you become ill with flu, the chances are your immunity is going to be poor, and you may be then more prone to get other infections, other viral infections, and COVID-19 is in circulation. As you know, we are in a pandemic. So get your flu jab, get your flu jab, get your flu jab.
Indeed.
And that would have serious consequences, wouldn't it, if you got flu and COVID virus?
Indeed, and it will be, but yeah, exactly. It's even harder to get both of them, and unfortunately, their symptoms are pretty much similar in many different ways, shape, or form, isn't it?
Yes, and so yes, Barbara is right about the fact that you get the high fevers, you get the coughs, you get the respiratory infection symptoms, and if you get if there are people who get flu virus and the COVID, the chances are you'll be very, very sick because the body won't have the immunity for any, because you wouldn't have had the flu vaccine to protect you, and the COVID-19 vaccine is already in circulation. So if we can avoid getting at least one of those infections, one of those viral infections, that is much better. And sometimes people say, and I think we're going to come to that in a minute, oh, if I take the flu vaccine, I will get flu, because that's what happened to my friend, my uncle, my aunt, my grandfather. The answer to that is you get some symptoms of feeling a little bit uneasy and cold, and some people get it more severe than others. But there is no evidence to say that you get full-blown flu if you take the flu vaccine. What do you say, Barbara?
Barbara?
No, I agree with that, and certainly that shouldn't put you off having the flu vaccine, because if you get flu,
oh, I think we might have lost Barbara.
Yeah, I think so.
So what the vaccine does is it reduces. Yeah, hi, are you back? It's a technology. Hello, are you back, Barbara?
No, I think so. The connection on Barbara's side is bad, unfortunately. Sorry, Sunita.
So yes. So the the symptoms of common colds and other things also are quite less once you've had the flu vaccine, because you've got the protection from the vaccine. It generates the immunity inside you so that you're more protected from developing a severe flu infection. So it's more important, therefore, then for this winter, for us to at least protect ourselves with the flu vaccine. If we've been called for it, let's go and get it, because it's an important vaccine to have, even if you've not taken it for the several number of years before this year, thinking, okay, well, maybe I'll not get the flu, or maybe I'm healthy enough, or I take lots of vitamin supplements and that'll protect me. I'll not go out of the house in the winter. I'll stay at home mostly. I'm not going to get in touch. The chances are you're still not protected. The only way of protecting yourself is to actually get a vaccine. If you're eligible, if you're in those vulnerable groups that we've talked about, then it's important for you to get the flu vaccine.
Indeed. Now, in terms of the pregnant women, I know we have briefly touched about those in the beginning of the show, that the pregnant women can have flu vaccinations as well. Now, when we talk about pregnant women, pregnant ladies, they've been asked not to take any medication whatsoever. So, how safe flu vaccines are for them?
It's a very, very safe vaccine, and as I was saying before, every year the vaccines are regulated very, very with a lot of stringent and care. And for pregnant moms, the vaccine is really important, because if you become ill with flu, it's very difficult if you become severely ill to treat you in hospital because you've got a baby. So it's more than important for the pregnant moms to protect themselves with the flu vaccine, because it's extremely safe. It doesn't contain any pork or anything that you're worried about. It doesn't only protect you, but it also protects your unborn baby. And the winter babies, so if the babies are born in the winter between now and March, will then continue to have the protection after they're born, because there is no vaccine to cover them once they're newly born. But the flu virus will still be in circulation. The flu virus is in circulation from December till March. So you protect not only yourself while you're carrying your little baby inside of you, but you're also protecting them when they're coming out, because they'll still also have the immunity for the while once they come out. And they also have less respiratory conditions. So what we know is our little babies suffer a lot from respiratory conditions and stuff, like they have, coughs and, colds and runny nose and stuff, particularly when they're babies' fevers. Some of those which are viral related, and if the flu virus is, if it's protected from the flu virus, those will also be less in the newborn babies. So it's very, very advisable. If you're a pregnant mother, then please go to your GP if your GP's invited you. Otherwise, if you're at the L&D hospital, then the Luton and Dunstable Hospital and the Bedford Hospital will also be vaccinating if you're going for your scans or your appointments to the hospital. I know people, mums are scared to go out, and that is understandable, absolutely. But if you're going for your appointments, please ask your midwife. They can actually vaccinate you at the hospital. If not, if your GP has invited you for a flu vaccine, please go and take your vaccine, because it does not only protect you from flu, and it also protects your unborn baby. And if you become ill with flu, then it's very, very difficult for us to look after pregnant mothers, because we can't give you all of the medications that we could have normally given to other people. And also because you've got a pregnant uterus inside your abdomen, it's very difficult because it presses on the lungs. So it becomes really complicated. So please protect yourself with the flu vaccine.
Indeed. I just have another question popped on my screen as a text message. It says, why is it important to have flu vaccine every year?
Yes, so very good question. So what happens is the influenza virus is a virus, and there is a lot of work that happens to trace the kind of strains of virus that are coming into as we come in, which are circulating in the year that we are. And so then the vaccine is produced to combat the virus that is in circulation. It's the same group of virus, but they change slightly in the kind of their makeup, and they mutate. It is the way the viruses are. So we need to get a vaccine that protects us from the viral strain that is in circulation for this year. So that is why it's very, very important for us to make sure that we get the right strain for the right virus. That's why we need to have the virus, the flu vaccine every year, because the vaccine that you're getting this year is going to give you protection for the virus that is in circulation this year. So that is why every year the whole flu vaccination programs go through a huge rigorous regulation, so that we certify and identify which viruses the vaccination will come for.
Indeed, and definitely when we talk about vaccination program itself, now I know in Luton we were very, very fortunate enough to have a very unique program where all schools in Luton, anybody who's below the age of 16 can have injectable vaccine, which do not have flu content, and everybody in Luton now have this two option. Because last year when we have a pilot schools, or even in the beginning of this year when we just have a 10 pilot schools, children who have given this two options of injectable vaccines or the nasal vaccines for children's. Isn't it now we have two different options available for all the school kids?
Yes, and a big thank you to the parents in Luton, because and if Barbara was here, I think we've lost her through the technological glitch. she would be able to say that it was the studies that we did in the 10 pilot schools for the last 4 years, where the injectables were given to our school children in Luton, which has then pioneered the national change in policy this year, that if you do not want to take the nasal flu vaccine because of the gelatin that's in the pump, so there is a little pump that you have to just squirt the vaccine into the nasal cavity, and there's a little bit of gelatin that kind of is in that pump, I think, which has got the porcine content. And either way, this year, therefore, nationally, it's the Luton schools and the work that has been done in Luton, and a big thank you to all of your parents and all the schools in Luton for helping us to make this change in policy, which is now a national policy, that anybody who does not want to take the nasal flu vaccine for their child because of the porcine content or the pork content can have the injectables. So that is now available to all schools. It's also available to the 2 to 3 year olds who don't go to school via your GP. We've ordered enough vaccines for everybody to get it. So please, the children that are going to mingle over the Christmas holidays with all of us, we've missed them, haven't we? I mean, I know I've missed meeting my family in the very little restricted way I can meet a few of my family members. I'd like to know that they are at least protected, and then we are not going to be spreading flu around as well. Hopefully, if you're eligible, if the kids are protected, then we know that they don't, they can't spread the virus, because they can actually spread virus. And when you've got your grandma and your elderly aunt, or people like me, if I've got diabetes or respiratory condition, rheumatoid arthritis, for which I'm taking medication, which is suppressing my immunity, then I'm vulnerable. So, the sooner we can protect the people around us with the flu vaccine, the safer we are as well. And the safer the people are who are vulnerable to getting the flu vaccine, getting the infection from the flu virus.
Indeed. And we just joined by Barbara. Luckily, the connection has...
Apologies for that.
No, that's perfectly fine.
Zoomed out.
Indeed. So we were talking about the two options for school children, and apparently the children in primary schools, because at the moment for this year the schooling vaccination program reaches to the year 7 secondary schools as well.
That's right. That's the additional year this year.
So every single child from the year reception to year 7 have now two options in Luton.
Yes, and can I just say one thing as well? The immunisation team might have already visited your school, and we've only been allowed to do give the second option at the end of just now, really, in the last couple of weeks. So you'll have sent your consent into the school and probably refused to have the nasal flu. Don't worry, because you're going to get another consent form for the second option of the non-porcine vaccine. So the immunisation team will go back and vaccinate your child, but you do need to let them know. You need to let your school know. The consent form will come out. You need to fill the consent form in and send it back to say that you would like to have the option of the no pork vaccine.
And also, if you already missed out somehow for any X, Y, and Z reason, you can. I think so. These parents can join directly as well. Can you hear me?
Five. What do you mean? They can join directly?
Oh, sorry. They can contact the school immunization team directly.
They can. They can. Yes. Yes.
Sorry, I was saying join directly. I thought you can't hear me. In that sense. Okay. In regards of the So, in regards of the vaccination itself, now you have in the beginning of the show did mention regarding the carers can have vaccines as well. So, is it for both registered and unregistered carers? Sunita?
Yes. So if you're caring for a vulnerable person, then ideally you would be the main carer and you'd have registered with your GP as the main carer. So you should be eligible for the flu vaccine from your GP practice. If you're caring and you're a social worker working in a care home, or if you're offering care packages to somebody who's housebound, then you are also eligible. So through your care agency or through your care home, you should have got an eligibility letter, which makes you eligible for the NHS flu vaccine. You can take that letter to your pharmacy and or to your GP, and you should be able to get the vaccine. Please do not get deterred if your pharmacy or your practice says, sorry, we've run out of vaccine.
Yeah.
They will call you back. The vaccine it's been a really unprecedented demand on the flu vaccine this year. We are just not being able to bring supply quick enough for the number of people requesting for the vaccine. This is in our pharmacies and also in our practices. So if you are eligible, if you've got a letter, or if you're eligible as a carer, or if you're eligible as a household member of a shielded patient, and you approach your practice or you go to your pharmacy and they tell you, sorry, we've run out of vaccine, they should take your detail and they'll call you back. The vaccine's coming. It's just that it's on the production line. We're just not being able to get it onto the front line quick enough. So please bear with us. So those are the kind of carers. And then Barbara wants to talk about supply.
No, Sunita, I was just going to say, very much so. If you go to your GP or your pharmacist and they say they haven't got the vaccine at the moment, please do not despair, because there's not a big warehouse with all this vaccine. It's being manufactured as we speak. So it's constantly on this conveyor belt of manufacture. So a supply comes to the GP pharmacist, they use that all up, and then they're waiting for the next batch to come. So it's not a continual day, there's vaccine coming. It's being manufactured as we speak. And just to add to the carers as well, I would like to also say very much foster carers who are looking after looked after children are also included in this. So please, would you also come forward and have the vaccine so that you're protected against the flu?
Indeed. And on that note, I must say, wow, the time has passed really quickly. We just literally have under 3 minutes now to finish the show. So on that note, I must say, if you both give some positive messages to our lovely people who are listening us or viewing us, or who will be viewing us later on, because this will be on Facebook and YouTube. So let's start with you, Sunita.
So please have a very safe rest of the year of 2020. It has been an eventful year, but to make that year more positive, let's send the year off in a more positive, healthy note. Please get your flu vaccine if you're eligible, and please have a safe end of the year, and whatever you do, enjoy with your family, but stay safe. Make sure everybody around you who's eligible has the flu vaccine, and make sure that you're protected against the flu, because that's one vaccine, time tested, that we know will work and will protect you. So please take your flu vaccine.
Indeed. Barbara?
And what can I say after that? But just to say what Sunita said is absolutely true. The only thing that will protect you against flu is the vaccination. So you need to go and get it. Like I said, it's there for you to have. So please, at least be safe where flu is concerned, and have start the year healthy and protected against flu.
Can I just add one more thing before we absolutely end?
Yes, please.
This is a message to all mums with young children. Do not forget about the other vaccinations we've got for our childhood immunization. So mumps, measles are also circulating. So please do not forget that it's only COVID which can affect our children. Our children can get affected with flu, with measles, with mumps, and those are even really, really bad, and they can really, really affect our children. One child can, affect a lot of, children. So please, if you've also been invited for your children's vaccines,
please go.
Please
go.
Please.
And it doesn't have, for instance, measles vaccine. There's 2 vaccines, one with pork and one without. So you can all have the one without.
Yeah.
So you can protect your children against measles. So
indeed. So yeah, definitely on that. Wow, I must say that is a very powerful message, that vaccination is important, regardless whether it's flu vaccine or MMR, commonly known as measles, mumps, and rubella vaccines. If you've been invited, please do get in touch.
Please.
On that note, I must say thank you so much to both our lovely guests who are part of the show throughout the show, and thank you so much for your guidance and advice regarding our topics today. And absolutely, thank you.
And thank you for the audience for taking the time to listen.
Thank you so much.
It's appreciated.
Thank you so much. So guys, on that note, I must say we are reaching to the end of the show. If you have missed any part of the show, you can always view us on our Facebook and YouTube channels. Next week, Brother Leo will be back on talking about nutrition, health, exercise, and martial arts as well. So please stay safe, stay healthy, and as Dr. Sunita says, try to enjoy your last few months or last month of this year in a nice, safer way, and get yourself vaccinated as much as you can. I'm your host, Fahad Mating, saying Assalamu alaikum.
Bye.
Thank you.
Thank you.
FM on 105.1 FM. Coming up next, weekly